You know, there's a very popular IUD brand that tells you not to put it into the uterus of a woman who hasn't had kids.
Hi, I'm Dr. Fran. I'm an OBGYN, and I actually had not heard this piece of information before. And as someone who places a lot of Mirena IUDs in nulliparous patients, I wanted to dig a little deeper because at this point, over 200,000 people have seen this video, and I wanted to see, is this true or not? I'm going to use my friend Fatima's rules about looking at information presented to you on the internet about medicine. And her first rule is looking at the credentials of the person presenting it. In this situation, the person talking about IUD insertion and complications is a student of chiropractic medicine. So someone who does not place IUDs, practice obstetrics and gynecology, or deals with the complications, or does pelvic exams at all. I firmly believe that when we talk about medicine on social media, we really need to stay within our scope of practice. So that's why you don't see me talking about liver diseases or brain tumors or spine surgery, because that is not what I have been trained in. I have been trained in obstetrics and gynecology, and that's why I talk about obstetrics and gynecology. The second step that Dr. Fatima talks about when you're looking at information on social media is what is the source of the information that they are providing. So let's see what the source is.
Read your package inserts.
So let's go to the insert. So this is from the FDA website for the Mirena IUD. And it says it is recommended for women who have had at least one child. It is recommended. Now let's look in the contraindication because we were being told not to place it, and that would be the contraindication. And I do not see anything about being a nulliparous patient receiving an IUD being a contraindication. You may say to yourself, well, those sound kind of similar, like it is recommended for patients who've had one baby. Sounds like they're saying don't put it in people without a baby, but that is not the same thing. Just because it's recommended for a patient who's had a baby doesn't mean it's contraindicated for patients who have not. And I think that's a really, really important distinction between those two statements.
There are some theories starting to come out about how inserting an IUD into the closed, tight cervix of a woman that hasn't had kids can affect future births.
That is a theory I have not heard about being discussed. So I looked into it on our very best friend, PubMed, because we want real studies, information that guide when we're talking about medicine. I found one article from 1991 from Russia that mentions cervical insufficiency with an IUD and nothing since then. So we don't have any evidence from the last 30 years that suggests that Mirena IUDs are associated with cervical insufficiency. Yet it keeps being discussed and liked in the comments of this video as if it's fact. Based on this information, I feel very comfortable continuing to place Mirena IUDs in nulliparous patients. And I hope that you, as a patient, also feel more comfortable if it's recommended to you.